Senator, thank you for raising the issue yet again. I think we recognize that at the time that question was asked, there was great debate on where we were with the ACA and that impact. And you're right, I do recall saying that would be really very, very helpful for us at that time. We're no longer entangled in the immediacy of the discussion about the ACA, but from my perspective, coming from the state of Alaska, I know that we as a state are looking at ways that working with the federal piece and trying to understand how we can do better when it comes to providing a level of services in Alaska. This type of information would be helpful to us to understand the impact of the Medicaid payments and how it flows through the IHS system. I can appreciate that there is entanglement there, but it really would be helpful to get a better handle on these numbers. And I know that we were very frustrated a couple years ago because we could not discern it. And we figured that there has to be somebody who works within the hierarchy here who can figure that through. So I think I think it was a reasonable request then, and I still think it's a reasonable request, and I will back Senator Van Hollen in his request for greater understanding on that. Admiral, yes.
Thank you, Chairman Murkowski and Senator Van Hollen. I was reminded by our Chief Financial Officer that we have recently initiated an engagement with the Government Accountability Office, specifically looking at the issue of impact of Medicaid for the Indian Health Service. So that is an engagement that is underway. Anything you want to add on the scope?
I think just in terms of that, so we do have data on the third-party collections and what we've been able to collect for federal facilities. For example, we've seen 51% increase in Medicaid collections from 2010 to 2018. And what we hope is through that our active participation in GAO's current engagement on looking at the effects of the Affordable Care Act on health coverage and funding for American Indians, Alaska Natives, that will be able to help to address more of these questions that you've been asking. So in addition to the data that we can provide on the third-party collections state by state and looking at those trends, of course, with the qualifiers of where we don't have access to tribal collections data, and there may be some other socioeconomic factors that contribute to those differences. But we hope with the GAO's study in progress that will help address more of these questions.
When would you anticipate completion of that GAO report?
I know they've been working on it very steadily, and I think the initial anticipation was during the summer, but we don't control their schedule. We too are anxious to see the results, and I know they're working very hard on that.
Well, I would ask that you be able to report back to the committee and not a year from now when we have the next budget hearing, but as that report becomes available and we are able to review that in conjunction with the data that you have collected. So we'll be checking back in with you in, let's just say, 3 months or so to see where we are, because I think this information would be helpful.
Thank you.
Thank you.